you were pregnant with 10 babies at once, your belly would stretch to the size of a giant beach ball.
Yep.
Inside,
whoa. Bulletproof skull plates, alternate uses for tilapia, and you know what I always say, don't pull it out. Today, we're back breaking down and reacting to all of the jaw-dropping medical scenes and life-altering injuries from Zack D Films. Let's dive right in.
if you get stabbed in the eye,
If you get stabbed in the eye, sorry that you were in that position. Don't pull it out. Please don't pull out the knife. Just leave it in place. If it just goes, say, in the white parts of the eye, the sclera, you're not hitting the specialized cells of the cornea. Won't hurt as bad, but you get worried that the fluid of the eye is going to come out.
place a cup around the knife and wrap it in gauze to stabilize it.
Yep. If you go through the colored part of your eye, you're going through the cornea, you're going through your pupil, but the pupil is just the window into the back of your eye where your cornea is, so you can hit your cornea, which can cause damage to that. If you get it all the way back into the retina, you could potentially have some vision loss in that specific area.
Then cover both eyes. This is because if one moves, the other moves too, which can tear the wound open even more.
Yep. Great advice to close both eyes, but make sure you have somebody with you because you don't want to be just trying to feel around and get yourself to the hospital.
Keep your head still and get to the emergency room, where doctors will carefully remove it before sealing up the hole in your eye.
Yes.
Yes.
Doctors sewing this up or fixing it or sealing it up, it's not all doctors. It's not emergency medicine doctors. This is specifically an ophthalmologist, and not every hospital has an ophthalmologist.
He inhaled a seed while walking through a forest, not thinking anything of it.
So crazy. How many times has a fly or a bug gotten in your mouth? It happens. But a seed, that's pretty rare. When they say inhale, I'm assuming it is into the lung.
It was so small, it didn't even make him cough.
Yep.
But it settled deep in his lung.
When somebody says deep in the lung, that means it's kind of gone through all the narrow passages. So your trachea, your main stem bronchus, bronchioli, all the way down to the lowest area, which is the alveoli, which is unlikely that it got all the way there, but it got to basically a very small subsegmental area.
Over time, he started to feel pain in his chest.
You can feel pain in the chest due to irritation, due to infection, due to something potentially growing.
So he went in for a scan. Doctors spotted what looked like a tumor.
It's not a tumor.
Most times you're not going to immediately get a CT scan. You're going to get a quick screening chest x-ray to see if there is something there, obviously. The image that we're seeing here is actually probably an x-ray / a scout film. CT scanner is going to be a 3D view. This is just a 2D view image.
They found a small tree, nearly 2 inches long, growing inside his lung. It had taken root in the warm, moist tissue fed by his body instead of soil.
The body probably was also having a significant immune reaction, causing a lot of inflammation and swelling. There are multiple other steps that would happen before that happens.
If you happen to get kidney stones,
Kidney stones.
People have kidney stones for many different reasons. For me, anecdotally, I see often enough that usually it's familial, but there are other reasons why you could.
you could ride a roller coaster and let the shakes dislodge
Yeah,
them from the
100%
tissue
true.
walls.
There actually has been documented studies to show that getting on a roller coaster will help remove a kidney stone. But it's a little misleading here. They do not cause pain when they're in your kidney. It's when they leave the kidney and they go into your ureter, which is the tube from your kidney to your bladder.
Then, as the coaster moves, the change in speed shakes your whole body. And this makes them move into your bladder, where they can finally pass through when you pee.
Whew. Once it goes into your bladder, no more pain. All you're waiting for to happen is for you to urinate it out. When you pee it out, usually there's no pain. It's usually like a whoop kind of feeling. I have seen them occasionally get stuck within the urethra.
What's a urethra?
It's a tube from the bladder to the outside world.
If you instantly lost 300 pounds,
Do people who have had a significant amount of weight loss have excess skin that do need to have surgery to have it removed? Yes. Typically it's removed and tightened up, and you do have these line scars on your body.
surgeons could cut the loose skin along your torso and arms. Then they could stitch the extra folds together, joining them into wide wing-shaped flaps.
Did you guys know that your skin is your largest organ of your body? Could you attach your skin in this way surgically? Yes, you could. But you're gonna have decreased functionality. You're not gonna have full range of motion of your upper extremities or your lower extremities. You're gonna be limited by what you can do on a daily basis.
The loose skin on your legs would also be cut on the inside, then stitched together. And once fully healed, the stretched skin would spread out like a suit. And if you jumped off a building, it could catch enough air to let you glide.
Come on!
Come on!
Who would actually do this?
For just a few seconds.
Yes.
He shot twice from the car's window, sending both bullets straight toward the other man's head. Years earlier, that man had been in a car crash, and doctors used a thick metal plate bolted in place.
That is a massive metal plate, so there must have been a lot of damage to that skull.
When the bullets reached him, they struck that same side of his head, and the plate deflected them.
Wow, he's wearing his own inner helmet. Amazing.
It's almost as if you're wearing a football helmet inside your own head.
If this was more directly right on the forehead, does it stop it? Does it cause a dent in it? Or does it actually break all the way through? Depends on the bullet, the speed of that bullet, and how close you are when you actually got shot.
Sending them out the back of his head instead of straight through his skull.
Whoa.
He collapsed on the ground as the car sped away, bleeding, but still alive.
If this individual came to the emergency department, full evaluation, you're still going to get a CT scan of the head. The metal is going to give some reflection on the CT because of the radiation. It doesn't do well with metal, but you'd still be able to see if there's blood within the brain on certain areas.
If you have a lazy eye, you can wear these goggles, which show a special version of the game Tetris.
Ooh. Medical fancy term for lazy eye is amblyopia, basically a neurodevelopmental problem, versus I see patients who have cranial nerve defects relating to their eye. It looks almost like a lazy eye as well.
Now, your good eye would see only the bricks on the bottom of the screen, while your lazy eye sees only the falling bricks. And this forces your eyes to work together, which strengthens the signals that your brain receives.
This works, but it's very specific to the lazy eye problem. The same idea, when people have cataracts, they can put new lenses into the eye. So sometimes people have issues with nearsighted or farsighted. They can do basically multifocal length of a lens in each eye, or a distance in one eye and a distance in the other eye.
They removed the lump, sliced it open, revealing hundreds of tiny teeth inside.
Whoa, I was like, is this a tonsil with tonsil stones? No, this is a lump with teeth in it. What? An odontoma has all the structures, machinery to make teeth grown off of the gum where your teeth would be.
When the boy was 3, a tumor appeared in his jaw, and as he got older, it only got larger.
Why did we let this poor gentleman grow up with an expanding mass in the mouth? Was it not identified? Was it identified later? Maybe no access to healthcare? I don't know, but these are my questions.
The tumor was made of the same cells that usually grow teeth. But unlike his gums, it didn't know when to stop. So it kept making more and more. And when the dentist dug into it, they found over 500 teeth crammed inside.
Wow, those must be either really, really small teeth or a very massive mass that we're not getting a good depiction of.
With some as small as a grain of sand.
Grain of sand.
We're nothing but grains of sand.
You probably have to take a look at under a microscope.
So they removed every extra tooth, giving him a normal smile.
He would probably be anesthetized, probably be intubated. Don't have him moving around because if there's a complication, if there's a vascular issue, you don't want somebody moving around.
The cable snapped and fell on her face.
Whoa. If extreme roller coaster rescue has your heart rate climbing a little, that's exactly why I created Chillax by my company, Life Happens, to help calm racing thoughts when things get intense. You can find it at lifehappens.com or on Amazon.
The ride operator did nothing. The girl pushed the cable off her, but part of it had become wrapped around her legs. Suddenly, the ride dropped, pulling the cable tight. It sliced right through her, cutting off her feet.
Whoa. Lower extremity pulled right off. That is awful.
That's awful.
What do? Stop the bleeding as best you can. Pick up the amputated pieces and get to the hospital.
They dropped to the ground below, where a crowd gathered to watch. Now, doctors were able to reattach one of her feet, but the other was too damaged.
You might have something called phantom limb syndrome, where you actually feel discomfort and pain in the foot that's not there. And then the one that actually comes back, or the one that you were able to reattach, you can have nerve damage for a very, very long time.
If you were pregnant with 10 babies at once, your belly would stretch to the size of a giant beach ball.
Yeah.
Inside,
Whoa. You probably wouldn't go till full term, meaning full term typically about 40 weeks, roughly 10 months, even though we always say a pregnancy is 9 months.
if you tried to give birth, the babies would end up choking each other with their umbilical cords into a tangled mess.
These babies are not going to be the full growth size. When you start having more babies in there, you're not having them get that big. Each one, the weight of them is going to be a little bit smaller.
If you get a burn, take some skin from a tilapia and apply it like a bandage, would your injury heal faster?
It is true, but we're not just going out fishing and catching a piece of tilapia. Usually will heal on its own if it's a first or a second degree burn.
Fish skin stays moist over time, so it doesn't need to be changed as often as gauze. And the collagen inside can actually act as a natural building block for your cells.
These could be used in conjunction with regular grafting that we do versus, on its own as a temporary type of barrier to help the tissue grow. But they are a good utilization tool that has been used at hospitals. You're not going to become a fish person.
The surface is covered with bacteria, which could leak into your wounds and give you an infection.
There's a lot of other factors that go into it. Antimicrobial therapies, IV therapy, especially if there's a large surface area of burns, the pain management of this as well. And then afterwards, the scar formation that happens.
This is why the hospital cleans their fish skin with special chemicals first before placing it over your injury, helping your skin grow without the infection.
Has any of you out there ever had this happen to help a wound heal? Let me know in the comments. Zack D Films, I love checking these videos out. They do a really good job of entertaining us, showing us really cool medical advancements or things that could be done. As always, definitely check out these other videos that I've made. There's a big playlist of lots of videos with a lot of education in there. Don't forget to subscribe and turn on your bell notifications. Have the channel continue to grow so we can reach a bigger audience. Thank you so much for watching and stay healthy, my friends.